Hello, 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 everybody. Hello. Yay, it's Talk Tuesday and we're back. Happy New Year, everybody. Haven't seen you guys since last year. Happy New Year. Happy 2026. We're back. Hello, everybody. It is Talk Tuesday and I miss you all. But we are back. Talk Tuesday bring you more stories, more testimonies, more authors, more entrepreneurs. We are back. It is 2026 and thank God the snow is gone. Well, actually not gone, but we got through the storm. And I hope everybody is staying safe got through this storm. And so, yes, hello. Please share, please share, please share. Come on in, share, 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 share. Come on in. Again, it is Talk Tuesday. Listen, you know what Talk Tuesday is about. Talk Tuesday is conversations of inspiration, motivation, and empowerment. And we got a show tonight. Yes, we do. Oh, I'm so excited. Me and my guest, we were talking backstage, and both of us are so excited. Yeah, it's gonna be a great, great show. And so please join and invite friends, share this live of Talk Tuesday. One of my dear friends. Hey, Ange, one of my supporters. Hey, Ange. Listen, we won't be before you long. We're just on for an hour. But again, oh my gosh, I'm always excited with all of my guests on Talk Tuesday. I just thank them for accepting the invitation to come on to share. And tonight we have an amazing woman. She is a good friend of mine. We've known each other for years. We actually met through the industry, the modeling industry. She looks so beautiful, y'all. Made me want to run upstairs and put some makeup on. But yeah, she's a good friend of mine. Again, we met through the industry, and I think this show tonight is going to be very, very important. And oftentimes, we think we have a story and a testimony, and we truly, truly do. My friend Angie on here, she has an amazing testimony. But my guest tonight, she has an amazing story. She has an amazing testimony. And we're going to talk about it tonight. We're going to talk about a project we have worked on. And so, listen, I'm just running my mouth, but I'm about to bring my guest on. Okay.
Hey
Look,
sis.
look at her, y'all. She's so beautiful. Hello, hello, hello.
Hello, beautiful.
Oh my gosh. Thank you so I haven't said a name yet, but we're gonna get to that. But thank you so much, my friend, for coming on Talk Tuesday tonight. And I told you before, I normally send questions to my guests, but I wanted this to be very, very authentic tonight. And your story is such amazing. And so I wanted to come on and talk about it tonight. So, our viewers, introduce yourself. Introduce yourself. Tell us a little bit about you.
Yes, my name is La-Anna Douglas. Everyone knows me as Hope Still Stands. I am a model, a women's advocate, a mommy of two miracles,
Yes.
and in love with my husband. Been married for over 22
Oh,
years, and just grateful to be alive, to be able to share my testimony
yeah.
and advocate for others.
Yeah, absolutely, absolutely. And I was telling my guest here that we met through the industry and through the modeling industry. And I can
Mhm.
remember this may not be the first time, but I remember we first met, I believe it was at Artscape.
Yes.
And yes, and you walked in a room and I was like, okay, but what I believe when you walked in, it was your spirit, so
Oh,
kind, so nice, introduce yourself. And that's how we first met. And
oh.
I'm so glad that we did. I'm so glad that God had us to be in the same path, right? And so again, I thank you everybody. Tonight, this is La-Anna Douglas. Again, she's a great friend of mine, but I said tonight, I personally want to know more about your story and more about your testimony. Let's talk briefly about that.
Yes, went through a lot starting at the age of 10, having
Mhm.
horrible periods, not
Mhm.
understanding what was going on with me. The pain would be so unbearable. And I'm
Mhm.
like, I'm only 10 years old. And my mom would warm up warm towels in the microwave to lay on my belly because I would be in so much pain. I would, take ibuprofen and I'm still in pain, not understanding. I see other girls playing and having fun. And I'm like,
Mhm.
wow, I'm in so much pain. And then eventually we started going to the doctors. The first time I had my prep smear was at the age of 15.
Mhm.
And I was told that my cervix was invisible. I'm like,
Mm.
what does that mean? We were
Right.
never referred to another doctor or any specialist to figure out why they couldn't see my cervix. They just said it's not visible. I'm like,
Mm.
okay. I would tell the doctors I'm in so much pain, and you just labeled me as the girl with bad periods. So I
Mm.
carried that label. I started to feel like it's my fault, like this label on me. I'm the girl with bad periods. And I would have accidents at school. I would get up from the chair
Mm.
and stuff's all on the
Mhm.
chair at home in my bed. I mean, just so embarrassed. I remember one time working for retail, I'm ringing up customers and
Mhm.
I bleed all
Wow.
over my pants. I was
Wow.
so embarrassed. And I'm like, why is this happening to me?
Mhm.
I
Mhm.
also, as a little girl was being bullied. Little
Mm.
girl, I was also sexually abused. So it's like all
Mhm.
these things are happening. I'm like, why is this happening to me, Lord? I don't
Mhm.
understand. I felt like I wasn't enough. I started to have low self-esteem,
Yeah. Yeah.
that I wasn't worthy. And eventually, I met my husband. We started dating, and I told him, I said, I'm a woman with bad periods. I told him straight off the
Wow.
bat, like, there's gonna be moments that I won't be able to function. I'm gonna be laying in the bed. I'm gonna be
Mhm.
crying. I'm gonna be lumped over, and still going to doctors and still
Mhm.
being minimized. Like
Now,
my
now,
pain didn't matter.
now we know, and I'm not saying I was fortunate or unfortunate. I've never gone through any of that because of my diagnosis when I was younger. But
Mhm.
oftentimes young ladies, little girl, they get their menstrual early, and
Yes.
so being 10 years old at that time, and like really, really having a rough menstrual. Did you think this was just like normal?
Yeah, to me, I thought it was normal.
Mm-hmm.
But to other girls, they would have, oh, I just had spotting today.
Mm-hmm.
And I'm fine. I just took some pampering and I'm fine. I took
Mm-hmm.
a little medicine. I took Tylenol and I'm good. Me, I'm like, I'm taking 1,000 milligram of
Wow.
ibuprofen and I'm still cramping. I'm
Mm-hmm. Mm-hmm.
still like in so much pain, radiating down my legs. And I,
Wow.
and I would say to the doctor, I feel like I'm having two periods every month. Oh,
Wow.
you're a girl with bad periods. You're just a
Mm-hmm.
girl with bad
Mm-hmm.
periods.
Mm-hmm.
Not until fast forward, getting married
Yeah.
and we're a brand new couple, newlyweds.
Yeah.
And
Yeah.
I'm like, can't really enjoy myself because I'm in so much pain. And I'm
Yeah.
like, I waited until I got married, and my poor husband, he was so patient with me, but I felt like, wow, I'm not doing what I'm supposed to do as a wife,
Mm-hmm.
because I'm in
Mm-hmm.
so much pain.
Mm-hmm.
And then we were like, we wanted to wait a year before we start to have children, and it's like, I'm not getting pregnant. Like, okay, I'm trying and trying.
Mm-hmm.
We're trying. I'm not getting pregnant, but I'm not understanding the pain during my cycles was connected to infertility. I never knew what infertility meant.
Ah, yes.
No, in school they talked about say no to drugs. They talked
Yeah.
about this is your brain on drugs and safe sex. They
Mm-hmm.
didn't talk about fertility. They didn't talk about women that go through endometriosis or
Mm-hmm.
fibroids or having just bad periods in general. They didn't talk about that.
Mm-hmm.
So I didn't understand when I wasn't getting pregnant during the first couple of years of our marriage. I'm like, I don't understand what's happening.
Mm-hmm.
And soon I was sent to get a hysterosalpingogram. That's when they
Wow.
inject dye into your uterus. They put a speculum in
Okay.
and they inject dye to take pictures in your uterus.
Okay.
And so I thought it was a cyst on my right ovary that was growing on my right ovary.
Mm-hmm.
So they inject this dye. Usually, when you have these procedures, the doctor calls you the next day or in 3 weeks or 2 weeks, or you'll get a message in your email with the results. No,
Mm-hmm.
the doctor came in while I'm still laying on the bed. They allowed my husband to be in there because I was crying, I was screaming. The
Mm-hmm.
doctor comes in, the radiologist comes in and says, Mrs. Douglas, I'm so sorry, you only have half a uterus.
Wow.
I'm like, wait, I'm here for my cyst, this right cyst that's on my ovary. You're telling me I have half a uterus? what are you talking about? I'm so confused. I don't understand. I'm crying still. Like, now I'm overwhelmed. Wait a minute. I
Mm,
just went through this painful procedure and you're telling me I have half a uterus? But God is so perfect in his timing.
mm.
He's so
Yes.
perfect when he places you somewhere for a reason. At the time, I was working at the prenatal assessment center at this prestigious hospital called Walter Reed. This is
Mm-hmm. Yes.
where president goes, where
Yes.
prestigious people go. And I told my husband, I said, baby, I know I'm on sick leave. I'm on leave today, but take me to my job. He was like, you sure? I
Mm-hmm.
was like, yes. And I just had this procedure, no anesthesia, mind you. I said, no, this doesn't sit right with me. Half a uterus doesn't sit right with me. I
Mm-hmm.
go in there and I see this doctor, this colonel, and he's doing ultrasounds. So think about this. We're trying to have a baby. He's doing ultrasounds on pregnant women. So I'm walking into
Mm-hmm.
this facility and pregnant women are everywhere. And he's like, La-Anna, what are you doing here? I said, sir, I just had a hysteroscopiogram. These are my films. Can you please look
Mm-hmm.
at my films? He could have stopped me right there and said, you're not my patient,
Yeah.
especially as a Black woman.
Yeah.
He could have
Yeah.
shut me down and said, no, you're not my patient. You need to go find your own doctor. But instead, he
Mm-hmm.
took my films, put them in the screen. And I remember his glasses on the tip of his nose. He cuts the light on. He was like, you don't have half a uterus. You have two,
Wait a minute. Did you say two?
two uteruses. Now you rewind back. I said to the doctor way back when I was a teenager, I feel like
Yes.
I'm having two periods every month.
Mm-hmm.
No, you're just the girl with bad periods. No, I was literally having two periods every month because I have
Wow.
two separate uteruses. So I'm down like, what? What? So I went from cyst on my ovary, half a uterus. Now I have two
Two.
uteruses.
It wasn't something like you couldn't believe like this can't be.
In shock. I'm in shock. And he was calm about it because he probably, as a maternal fetal medicine doctor, he sees stuff like this all the time.
Mm-hmm.
This is his
Mm-hmm.
specialty. He
Mm-hmm.
says, and this is where he goes the extra step. This is where we
Mm-hmm.
need allies that go the extra step when it
Yeah.
comes to others' care. He could
Yeah.
have just said, okay, here's your films and go home.
Yeah.
I'll see you tomorrow when you come back to work. He says, you need to research a reproductive endocrinologist. What is
Wow.
that? I'm like, what is, I don't
Like
even know
this
what that
sounds
means.
all new to you.
Foreign language.
Right.
So I'm like, what? He's like, you need to
Mm-hmm.
do your research for a reproductive endocrinologist. And when I
Mm-hmm.
tell you, I was like Law and Order SVU, Private Eye, online,
Yes.
REP. I'm like, how do you even spell this?
Wow. Oh my gosh. And so what did
Overwhelmed.
what did you find like in your research? Like, of course, I mean, this is your body, so much is going on. I've been going through this for a long time. Did you
Mhm.
discover some things you were like, oh my gosh?
Yes, I was. At first, I thought I had a bicornuate uterus. So when you type in double uterus,
Mm-hmm.
bicornuate uterus pops up,
Mm,
which is two uteruses and one cervix, right?
mm.
So I'm like overwhelmed, still trying to come to grips with this, blaming myself, questioning everything,
Yeah,
questioning my
yeah,
whole life.
yeah, yeah,
You
yeah,
know what I mean?
absolutely.
Angry at those doctors that didn't believe me. But
Ah,
finally, I find this doctor at in Baltimore at John Hopkins. God
mm-hmm,
bless her. God bless this
mm-hmm,
woman. I
mm-hmm,
find her. I schedule an appointment, and she was like, "Come in right away." I come in right away. She
mm-hmm.
allows my husband again to be in the room because I already knew what was going
Yes.
down. There's going to be some howling and crying.
Yes.
So she was like, "Sure, no problem." When I tell you she did a thorough examination, this is the
Yes.
first time all these years someone actually did a thorough front and back.
Yeah, yeah.
I mean, I was screaming, crying, pulling at my husband, but I wanted her
Wow.
out. She was like, "You want me to stop?" I was like, "No, do what you need to do
Yeah, yeah.
so we can figure out what's going on."
Mm-hmm, mm-hmm.
And she was like, "Yes, we need to go ahead and schedule you for surgery." And I know as Black women,
Wow.
we're like, "Wait a minute, hold up." But
Yeah,
I'm like, I need to know what's going on.
right,
For my
exactly.
situation, I needed to get to the root of the problem. And I soon had surgery, laparoscopic surgery,
Yes.
and I was diagnosed with two uteruses, two cervixes, which is called a didelphys uterus.
Mm-hmm.
I was also diagnosed with endometriosis and fibroids. So
Sis, you had a lot going on. A lot
a
going
lot,
on.
a lot.
Ooh.
So that cyst they thought was on my right ovary was my right uterus that would fill up with blood. And when it couldn't take no
Ah,
more,
yeah.
everything would come out. That's when I would have those accidents
Mm-hmm.
everywhere.
Mm-hmm. Mm-hmm.
I'm telling you, I was just like, I was, I felt validation
Yeah.
and like a release that she told me this, but I was so angry.
Wow. I'm sure.
I was so
I'm
angry.
sure. Yeah. Wow.
Mhm.
Angie says, "Wow, sister." I know, Angie. That's a lot. That's a lot.
It's a
And so,
lot.
what happened after that procedure? Did it resolve anything? And also, Aunt Lo, she say, "How old were you when you had this surgery?" I guess the surgery that you're talking about now.
I had that surgery at 26. So this is
Mm.
16 years after starting my menstrual cycle.
Wow. Oh my
16
God.
years. And the endometriosis is the key. So
Okay.
besides the two uterus and two cervixes, the
Mm-hmm.
endometriosis on my fallopian tubes and my ovaries, my instead of them being out like this, the endometriosis is like rubber bands.
Ah.
So everything was literally tangled like this. So
Mm-hmm.
she had to, do what she needed to do to
Yeah.
release those rubber bands, those lesions, those
Okay.
endometriosis lesions, and also open my right cervix. So my right
Mm-hmm.
cervix was still shut. So that's another
Mm-hmm.
issue. So I had to
Mm-hmm.
walk around with a Foley catheter, I think that's what it's called, for a
Mm-hmm.
few weeks after that surgery. So
Mm-hmm.
it was a lot. It's like you're trying to take everything in and you're like, is
Yeah.
this really happening to me?
Right.
Am I in a movie?
Right.
You
Right. Right.
know, because it's
Right.
just overwhelming, but you're like, okay, I want to give my husband a child. I want us to have a baby.
Yeah.
So is this is what it takes, then this is what I'm going
Right.
to do. And as
Wow.
women, sometimes, especially black women, sometimes we are like this going forward and not
Mm-hmm.
really sitting in the moment,
Mm-hmm. Mm-hmm.
embracing the feelings of how you feel. Sometimes we're just like, okay, I need to be a
Yeah.
robot and keep going and keep going, and you forget about, but how do you feel?
Right. Because I think oftentimes as women, like you say, we keep going, but then we also get in our mind, oh, this will pass. But he's like, all this time, like this will pass. Oh, it will be okay. I'll get it checked
Mhm.
out later. And I know you talked about. I was reading some stuff about you. You talked about taking charge of your health because that sounds like that's something that you did.
Mhm. Most definitely, it's
Mm-hmm.
important. It's
Mm-hmm.
important that we advocate for ourselves.
Yeah, absolutely. I agree totally.
We have to, no
So,
matter what it is. If you have a bump on your hand, if you like, the doctor says, well, it's just a bump.
right,
Okay,
right,
well,
right, right.
okay, thank you for your time. I'm going to the next doctor.
Mm-hmm.
It's We
Mm-hmm.
have to speak up for ourselves.
Mm-hmm.
It's up
Mm-hmm.
to us because it's our
Yeah.
bodies.
Mm-hmm.
And it's so important. Mental health is so important while you're
Yeah.
on the journey. Check in
Yeah.
on your mental health. Talk to
Mm-hmm.
your family and loved ones about how you're feeling, because
Yeah.
in my 20s, I didn't really talk about it. They see the tears, but I
Yes.
wasn't talking about it because I was still
Yes.
trying to grasp the whole
Mm-hmm.
journey and all the diagnoses, and just still in pain, and still going to
Mm-hmm.
appointments and getting blood work and CAT
Yeah.
scans and MRIs. It's just so much going on. I wasn't vocally saying,
Right.
I'm hurting. I'm not just I'm hurting, I'm in
Not
pain.
physically, but
I'm
emotionally and mentally.
hurting.
Yes,
Yes.
absolutely, absolutely.
Yes.
Now,
Mhm.
after this is done, you have your procedure done. Were you kind of like thinking in your mind, children? Will I be able to have children? Now, I've known all my life. I'm a cancer survivor. I've
Mhm.
known all my life because of the cancer and my ostomies that I was not able to have children, and I was able
Mhm.
to accept that. I've known all my life, but now you're married.
Mhm.
Did you think? Will children come? Will I be able to have children? Will I be able to bear children? Was
Mhm.
that something that came to, or you thought about often during this
Yes.
whole ordeal?
Most definitely. Before the diagnosis, I was like, I'm ready to have children. My husband and I were
Mm-hmm.
like, we're gonna wait a year. We're gonna start trying. Since a little
Mm-hmm.
girl, holding baby dolls, that feeling, you're like, I've always wanted children. And then after the procedure, I was like, okay, well, we've had the surgery,
Yeah.
so of course we're gonna get pregnant. Well, time is still
No.
going on. I'm still not getting pregnant. I'm still being sent
Mm-hmm.
for blood work. I'm getting MRIs. They're still just trying to figure out, okay, well, we did the procedure. She's still not getting
Right.
pregnant. So the doctor said, let's try Clomid. There's a
What it, now,
medication that she
explain what is that?
Yeah, so Clomid is a medication that a lot of women take that go through infertility that kind
Okay.
of helps you get pregnant. Sometimes I think it's
Okay.
like your follicles start to form better on your ovaries. I don't know the
Mm-hmm.
exact reason why,
Mm-hmm.
but the thing is with Clomid, you can get pregnant with multiples.
Oh.
You can have more than one baby at one time. With my situation,
Mm-hmm.
having two uteruses and having two periods every month,
Wow.
I potentially on Clomid could have got pregnant with twins or triplets in this side of the uterus, pregnant with twins or triplets in this side of the uterus.
Wow. Oh my
Because it's
gosh.
two separate systems, two separate cycles every month. So my doctor was very nervous. She was like, "You're going to do this for 6 months, and that's it."
Mm-hmm.
So I took
Mm-hmm.
the pills. I was diligent, taking my pills, making sure I'm ovulating, all those things, and
Okay.
I still did not get pregnant.
Well, what you explained, it's almost it sounds like IVF or like a
Close to
form
it.
of it. Okay.
It's
Okay.
just the pill. So you're not doing any
Okay.
type of injections. You're
Mm,
not doing a
mm,
transfer. It's just a pill.
okay.
And I still did not get pregnant.
Wow.
And so fast forward, she was like, "Okay, well, you can't do IUI." So this is something that you don't know until you're diagnosed with a double
Mm-hmm.
uterus. You can't do
Mm-hmm.
IUI because the actual instrument, I think it's like a
Mm-hmm.
T shape
Mm-hmm.
that goes into an average uterus,
Mm-hmm.
cannot go into a didelphus uterus. It won't fit.
Mm-hmm.
So she was like, "You're not a candidate." So she's like, "We can't do IUI." I'm like, "Okay." But that's something that need to be talked about for other women that have double uteruses, half a
Yeah.
uterus.
Yeah.
Certain procedures you cannot get done because those instruments do not fit in our anatomy.
Oh, wow.
But you
Wow.
don't know that until someone tells you, you know?
Mm-hmm.
So
Mm-hmm.
so she was like, "Let's try IVF." Now I'm
Yeah.
saying this fast, but this has been years,
Yeah.
months that have
Yeah.
been passing by. And so we're hopeful, okay, IVF is the last resort. Like this is
Yeah.
has to be it. During
Yeah.
that time, I also had two more surgeries. Right.
Wow.
So that just to put that out there, I had two more
Mhm.
surgeries during that time. So we do IVF, and I'm like, I'm believing God, like this is it.
Yes.
Lord,
Yes.
this is the only way it can happen. Like you were optimistic. We were so excited. And IVF is very expensive.
Mhm.
Now we've come a long way since that time.
Yeah.
A lot of insurances are covering
Covering it
IVF,
now.
covering
Right.
IUI. My insurance did not cover it. My husband had to take money out of our 401k.
Wow.
$16,000.
Wow. Sacrifice.
Sacrifice because we were like, we wanted to have this is the only way.
Yeah.
And I
Yeah.
can imagine all the other couples or women that have babies on their own. IVF is expensive if you don't have a
Wow.
good insurance. If you or if
Mm-hmm.
your employer, some employers are covering
Mm.
IVF. That's a
Mm-hmm.
long way from what we were going through.
Mm-hmm.
So, anyways, we go for the transfer, and I remember the doctor. It was hard for him to get the speculum on my left cervix because they were trying to get me pregnant in my left uterus. So the fact that my right cervix was closed, that means it's called a incompetent cervix. I hate that word. That
Yeah.
incompetent is like it's not enough, like it's
Yeah.
something's
Yeah.
wrong with it. But
Mm-hmm.
that's what it's called, an incompetent cervix. And so
Mm-hmm.
if I would have got pregnant in my right uterus, I would have been better on bed rest the whole pregnancy, and they would have to do a stitch to keep my cervix closed. I would be so
Mm-hmm.
high risk and all these things.
Mm-hmm.
So he's trying to get the speculum on my left cervix. I can see it on the monitor.
Mm-hmm.
The nurse has the ultrasound probe on my belly, and he has the speculum inside me, and he's like, you can see him like almost sweating, trying to get it
Mm-hmm.
on my cervix. And finally, he does the transfer. And he was like, "It's done." And I could feel the cramping and everything. And I'm
Yeah.
so
Yeah.
excited.
Yeah.
They said, "Well, within a couple of days, you're going to get the result." I think it was a couple of days or a week. I can't
Mm-hmm.
remember. So my husband and I rushed home that day to get the results. We were so excited. They said, "Be home by 3 p.m." We're sitting on the couch, huddled together. And they called and they said, "Mr. and Mrs. Douglas, we want to let you know it's negative."
Oh.
I screamed. I
Oh.
cried. I dropped the phone. Wait a minute. Wait, 6.5 years. We went through
Yeah.
every step,
Yeah. Yeah.
every surgery, every procedure, every appointment. I was driving up
Mm-hmm.
and down from my job to the hospital. I mean, blood work, tilt me up this way, that way, up and down.
Yes.
And you're telling me, I remember we had 21 eggs, and
Mm-hmm.
then 6 embryos were viable.
Mm.
They transfer one embryo inside of me and I'm not pregnant.
Wow.
The heartbreak for my husband and I, like,
Yeah.
Lord, we're good people. There's other
Yeah.
people. I remember people would complain. I already have a girl and I'm having another girl. I already have a boy and I'm having another boy. And I'm like,
And you
we
got
just
negative results.
we just
Wow.
want one baby. We just want a
Yeah.
healthy child. And
Yeah.
you're complaining?
Yeah. Wow.
I just couldn't understand. I'm like,
Mhm.
when I tell you the depression,
Wow.
I was pushing it back, that depression, like pushing it
Yeah.
back, like,
Yeah.
because I'm focused. Like I said, I'm focused. I got to get this
Yes.
done. I have to give my husband a baby. I can't stop no matter how much pain I'm in physically and mentally. I got to keep going. But
Yeah.
when she said it was negative,
Mm-hmm. Mm-hmm.
that depression was like a dark cloud. It just
Wow.
overtook me. I couldn't get out of it.
Let me ask. I mean, you're talking about this dark cloud, and I know both you and I were Christians, we're believers. Um,
Hmm.
where was your faith? Where was that? Like,
I'm gonna be honest, my faith
yeah,
wavered. I'm a
yeah,
preacher's kid.
absolutely. Yeah.
My
Mm-hmm.
my dad's been preaching. He's now a bishop, but a pastor. All my that I know of, all I
Mm-hmm.
know is him preaching and going to church
Yeah.
and
Mm-hmm.
loving the
Mm-hmm.
Lord and serving
Mm-hmm.
Him, praise dancing, singing, giving my all to the Lord. And I'm like, Lord, we're good
Yeah.
people.
Yeah. Mm-hmm. Mm-hmm.
We There's people that are can have kids like that.
Mm-hmm. Mm-hmm.
Why is this happening to us?
Mm-hmm.
Lord, did you forget about me? I mean, I was questioning, and it's an
Yeah.
honest thing.
Oh,
Like
absolutely.
God is infinite. He's our
Mm-hmm.
creator. But
Mm-hmm.
I'm like, but Lord, do you see me? And
What about me?
what about us? Like, what do you
Mm-hmm.
see us? The
Mm-hmm.
tears, the many
Mm-hmm.
times I cried on my mother's lap, the many times I
Yeah.
cried with my parents and
Yeah.
his parents wanting a grandchild. We just didn't understand.
Yeah.
And
Yeah.
I remember doing that journey. My grandmother, God rest her soul, we were in the rehabilitation center. This was 2 days before she went home to be with the Lord.
Mm-hmm.
I'm sitting there, we're watching westerns, I'm helping her with her medicine and she's
Yeah.
eating, and she stopped what she was doing and she points to me, the baby is coming.
Wow.
I was like, who are you talking about? See,
Yeah.
even in my depression, I
Yeah.
couldn't
Yeah.
see. She's pointing at me
Mm-hmm. Mm-hmm.
saying the baby is coming. I don't know she's talking about me.
Yeah.
So I'm like,
But
Grandma, who are
but
you
God
talking
knew
about?
though.
But
Because
God knew.
God will use who he wants to use to relay his message to who
Exactly. But then it's like,
absolutely.
but we have to be ready to receive it.
Yeah, absolutely.
I was so blinded, I didn't receive it.
Yeah.
I'm naming everybody else, my sister, family members,
Yes.
naming them. And she said, no, no, no. And they had babies after she said
Mm-hmm.
this. She said, no, no, no. The baby is coming.
Wow.
And I said, Grandma, you talking about Jesus? She said, Jesus was a baby. She said, but I'm not talking about Jesus.
Yes.
So I have to say that testimony that
Yes.
prophecy that she prophesied to
Yeah.
me,
Yeah.
because it's for a reason. She knew the Lord
Uh-huh.
used her, and she knew before she
Yes.
was going to go home and
Yes.
be with the Lord, I was going to have a baby.
Yes. Yes.
Right? So fast forward, I'm telling you, depression was on me.
Yeah.
My one night, my husband, and this is a trigger warning, my husband is working night shift. And I'm like, the devil's saying to me, it's not me, the devil's saying to me, you should just end your life.
Wow.
You're not woman enough.
Not yeah.
You should just
Mm-hmm.
kill yourself. Why are you wasting your time? Just
Mm-hmm.
You should just end your life. And I
Yeah.
walked into the kitchen and I start pulling up the knives.
Wow.
Okay, this
Sis.
is I'm telling you, this one's serrated. Okay, okay. This one is okay, it's straight. Okay, this one's not long enough. And then finally the one
Well,
okay, this is the one I want to
sound like
use.
you had a plan.
Had it all planned out.
Mm.
Had it all
Mm.
planned out. And
Mm.
God said to me, La-Anna, your life has a purpose. Hope still stands.
Wow.
I said, me?
Mm-hmm. Mm-hmm.
My life? See, I thought my worth was based on if I could be fruitful and multiply.
Yeah.
If I
Mm-hmm.
could have a child, that's where my worth is. The Lord was like,
Mm.
no, you are worthy just as you are.
Yes. Yes. Thank you,
Hope,
Lord. Ooh.
hope still stands. My middle
Mm-hmm.
name is Hope.
Mm.
See how things. God knew when my parents had me and named me La-Anna Hope. He
Mm-hmm.
knew the journey that was going to be ahead of me. I didn't understand my middle name. I never even looked up my middle name, what it meant.
Mm-hmm.
Never looked it up. But he
Ooh.
said hope still stands. That name, my Instagram, that's not just because.
Yeah.
That's
Yeah.
what the Lord gave me.
Yes.
And
Yes.
so I put that, I remember putting the knife back into the butcher board and I just cried.
Ooh. Ooh.
I could have killed,
Ooh.
I'm 40, about to be 45 this year.
Mm-hmm.
27, 28
Yeah.
would have been my
That
last
could have
year.
been.
Could have been my
Mm-hmm.
last
Mm-hmm.
year.
Mm-hmm. Thank you, Aunt Lois, for he knows
I,
the
I
plans.
want to see
Girl.
these messages. I can't see them.
Oh, I'm sorry.
God bless you.
Yeah, she put up the scripture 20, which is, she know that's one of my favorites, Jeremiah
Jeremiah
29:11.
29:11.
29:11, yes.
He knows the plans. See, we have
Yes.
planned. We thought we had no planned out that IVS was going to be the plan.
Ah, uh-huh.
That wasn't the
Hmm.
plan for
That
us.
wasn't the plan.
That wasn't the plan. So, we just thought that's what it was supposed to be. So we went down that journey. And I
Mm-hmm.
remember I said to my husband, move on.
Ah,
Now, I've said this to him before, but this particular, I said, move on, marry
yeah,
someone else. You could
yeah.
have had 2 or 3 kids by now. It's been almost 7.5 years. You could
Mm.
have. He said, I love you. This is where I needed this.
Yeah,
He said,
yeah.
I love you with or without children. And it was like a light bulb said, bing.
Mm-hmm.
I'm so caught up in I have to give him a baby.
Yeah,
But he was like, wait, I love you if we don't have
yeah,
children.
yeah.
It's
That's that's
okay.
that's unconditional love. And also God put him in your life for a reason,
For a
right?
reason.
He had to pull you back just to let you know you are loved. You are enough.
And you are enough. And
Ooh,
and when
ooh,
he said
ooh.
that to me, it was like I released it.
Yeah,
He said,
yeah.
let's just love on each other. Let's just enjoy
Mm-hmm.
life. And I
Mm-hmm.
remember we went to my mother-in-law had this ball.
Mm-hmm.
This is when the Obamas, I guess that's the right time. The Obamas, Mrs. Obama wore that white dress. Remember that
Uh-huh.
white? I think that was
Yes.
inauguration, or I can't
Uh-huh.
remember. But she
Mm-hmm.
had this white sleeveless dress, and I had the same type of dress. I had my little short haircut, and I wore it to the ball. They were like, "You look like Michelle Obama." I was like, "Oh, you're kidding? No, you're like, yes, yes, no, yeah." And so we just danced and just loved on each other and just had a
Wow.
great time.
Mm-hmm.
And we came back home like regular. And I remember
Ah,
July 2012. I think it was July 2012, July
mm-hmm.
6th. And I woke up and I was like, I have to go to the bathroom so bad. Oh my gosh.
What is going on?
What is wrong with me? Like, so I fell on the left side of the bed and my husband's not there. And I'm like, remind me if I forget to tell you where my husband is. I said, baby, are you okay? He was like, yeah, I'm all right. I said, okay, I'm going to take a pregnancy test. Oh,
Mm.
and I'm talking to myself. I'm going to take a pregnancy test. If it's negative, I'm not going to tell him. And I
Mm-hmm.
was like, if it's positive, I'm like, Lana, you know it's not going to be positive. I'm like
Uh-huh.
having like a whole conversation. That's
With
how we get
yourself.
sometimes with myself, okay? So I take the pregnancy test and I'm like, Leanna, don't look. Because I'm always, every time I take pregnancy test, I'm always like looking.
Right, right, right.
And I go to look and I see 2 lines. I've only seen one line or negative or no,
Yeah,
you're not
yeah,
pregnant.
yeah.
So I'm like, 2 lines, what does that mean? So I'm reading the box. I don't understand. What does that mean? So I'm reading the box. 2 lines mean pregnant. I'm like,
Right.
no, I'm not. You lying. I start screaming. My husband runs up, what's wrong? What's wrong? What's wrong? I said, I just took a pregnancy test and it's 2 lines. He was like, what does that mean? We're like, we've never
Right.
had 2 lines. So he's looking at the box, looking at the test. He was like, baby, that means you're pregnant.
Right. Yes.
I said,
Wow.
you're lying. He was like, baby, you're pregnant.
Oh
I
my
called my
God.
mommy. I'm like, mommy. My mommy she's retired now, but she was an OB nurse. Mommy, the pregnancy test says positive that I'm pregnant. She said, I'm getting dressed. We drove to
Where
John
y'all go?
Hopkins. It's early in the morning. We drove to John Hopkins, flew. We come in there.
Oh
I said,
my.
I demand appointment. Now I'm high risk. I was crazy. I was a lunatic. When I tell you, I need an appointment now. I need an ultrasound. They were like, Mrs. Douglas, calm down. There's patients everywhere. I need it now. And my husband's just standing there with my purse. I gave him my purse. He just And my mom's like this. They're like, we can't get you in today, but we can get you in tomorrow.
Oh my
They
God.
did an ultrasound and I was 5 weeks pregnant.
The miracle number one.
Still, when I say it, even now, I'm still like, what?
Did you think, I mean, you think back and you like, God, that's what God meant. Let God, let go and let God. He was
Well,
waiting for you to do that.
you had to release it. Don't try to do it your way.
Yeah, yeah.
Grandma, the baby is coming. Don't try to do it.
Wow.
Don't block your blessing. Believe it.
Mm.
When someone tells you, if somebody comes and says, I have some money for you, oh no, you don't have to give it to me, give it to somebody else. Wait a minute. They're
Mm-hmm.
giving it to you. I'm not
Mm.
saying to not share it with somebody else,
Wow.
but if somebody comes with a word, with a message, with a
Yes.
blessing, why
Yes.
not receive it and expect it for yourself?
Absolutely.
Why not? Why can't you have
Mm.
greater? Why can't you have the best? We're God's children. We're King's kids. Why can't we expect blessings and favor on our lives?
Yeah, yeah,
And that,
yeah.
I'm telling you, my little baby, her little heartbeat. But I remember, thank you, Lord, my husband, while I'm taking the pregnancy test, now this is, like I say, God does all things well. And it's
Yes.
also our petition.
Yeah,
Even when my faith couldn't reach out, his faith reached
yeah,
out.
yeah, yeah.
Even when I
Mm-hmm.
couldn't pray those prayers, when I was in so much pain
Mm-hmm.
in my heart,
Mm-hmm.
he continued to pray. He even set aside a room and put diapers in that room.
Wow. He's
My
speaking.
husband
He was
was
putting it in the atmosphere.
okay.
Yeah.
Even when I couldn't see it for us, he was
Mm-hmm.
already putting it out there. So he woke up that morning. I'm out, knocked out. Went downstairs. He's laying on the floor reading about Hannah, petitioning
Ah,
the Lord for Samuel, and he's
Jesus.
praying. That's what he's doing when I wake up to take the pregnancy test.
Wow.
What?
It was already in the plans anyway.
It was already in the plans.
Yeah.
Now that little baby is
Yes.
13 years old, honor roll student,
Oh my God.
taekwondo, playing the flute. She's literally playing the flute right now. I can hear
Yes.
her. Mind blowing.
God performed miracles.
He performs miracles.
Ooh.
But God said, I'm not done.
Mm.
God wasn't done. And I thought that was it. God said, oh, I'm going to show you
I'm
better
gonna
than I can
show
tell
you.
you. So I was like, okay, years start passing by. My husband was like, okay, we had one. You maybe you'll get pregnant
Yes.
again like
Yes.
that. Maybe within a year
Yes.
or two. Okay, before I go there, I have to say for my brothers and sisters out there that go through
Yeah.
IVF, when I was 6 months pregnant with Olivia, that's my
Uh-huh.
oldest,
Mm-hmm.
those embryos were still freezing and
Wow.
they're in the freezer.
Mm-hmm.
But we couldn't afford to pay.
Ah.
So I have to say this for those that are going through
Yeah.
infertility right now and dealing with
Mm-hmm.
IVF. We could not afford to pay for them to be
Mm-hmm.
stored anymore. So I literally had to grieve these embryos while pregnant with my miracle.
Oh
Let's
my
take it
God.
in. My husband
Wow.
is saying to me, I called the office and they say you have three options. And I'm crying while holding my belly.
Mm-hmm.
I when I think back, I'm like, I was sitting in this pain, but I'm grateful at the same time.
Mm-hmm.
You can
Mm-hmm.
have both feelings. I'm
Mm-hmm.
grateful for this blessing, this
Yeah.
miracle, but
Yeah.
I'm hurting and grieving for these embryos that could have been.
Wow.
So he said, the doctor said there's three options. You can donate it to a couple,
Ah.
donate them to a couple,
Mm-hmm.
donate them to science, or discard them.
Mm.
So I'm literally crying. And my husband said, I am so sorry, baby. We have no choice. Now, at the time, we did not think, I don't know why, to
Mm-hmm.
ask our families to help us pay for this
Ah.
$1,000 storage fee. But we were just overwhelmed. And my
Yeah.
parents
Yeah.
still to this day, they said, why did you ask us? And it's like, I don't know why.
Mm-hmm. Mm-hmm.
Maybe this is part of our testimony to help somebody else.
Yeah.
That's the way I
Yeah.
have to think of it.
Uh-huh.
But I told my husband, make the decision,
Ah.
but don't ever tell me what you did.
Really?
To this day, he has
He
never
still
told.
has not.
He has never told me. And during the first couple of years, even after having Olivia, I would
Yeah.
see kids. I'm telling you, my sis, I'm telling you,
Mm-hmm. Mm-hmm.
I
Mm-hmm.
would see children walking, and I would say,
That could have.
that
Mm,
looks like my husband. I'm
wow.
telling you,
Wow.
I would see children walking around. And I'm like, she looks like me. I had to really pray on myself because that's another part of mental health because
Yeah.
we had no choice. We could have had helped asked our parents for help, but
Yeah.
we didn't think about it.
Mm-hmm.
But that's part of the grieving and the mental health part of it. I'm like, I had to
Mm-hmm.
deal with that.
Mm.
Even though I have my miracle, this blessing,
Mm-hmm.
those 5
Mm-hmm.
embryos, I still to this day don't know.
Don't know.
So I have to say that because I know there's a lot of
Mm-hmm.
people that are going through IVF. Talk to your family, talk to your parents, talk to your
Yeah.
friends. If you can
Yeah.
afford something, say, hey, can we all chip in? Because this baby is going to be our baby.
Yeah. Yeah.
So I'm telling you, I implore you,
Mm-hmm.
share with others what you are going through because I'm telling you, somebody may say, I'll give you $10,000. I'll give you $500. I'll give you $3. We'll do a
Yeah. Yeah.
GoFundMe. But we didn't do that. So I had to
Yeah.
share that to help somebody.
Mm-hmm. Mm-hmm. Thank you, sis. Thank you. And
Yes.
thank you everyone for joining. We're hearing this awesome testimony. And I'm
Thank
still
you.
kind of like this because
I
I'm
know.
just telling you right now.
know. I know. I'm saying it like,
Yeah,
but it's a
yeah.
lot.
It's a lot. And I think
It's a lot.
oftentimes, we all have a story to tell, a testimony, but when you hear other people, you're like,
I
oh,
know. I know.
what?
I
You know
know.
what I mean? And that's what I'm doing now. And I'm going to tell you the reason why, because during my cancer diagnosis, when I was younger, I had what we call a total pelvic exoneration. So what that means is they removed all of my pelvic organs, right? And you can
Wow.
he's like, oh yeah, they removed all. So when I hear and as I got older, I was like, they removed that. What is that? They removed that. Well, what is that?
Yeah.
You know what I mean? So when I'm listening to your story and the research I did when I was a teen, I'm like, what? I don't
Yeah.
have, and she went, you know what I mean? It just
Yes.
kind of like I'm like, you know
I
what
know.
I mean?
I know. Oh,
Wow.
sis. Wow. 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 And I can
Yeah.
imagine you have to go through that, like
Yeah.
mentally, you
Mentally
know.
growing up, knowing that you don't have this and you don't have that. One thing my mom told me, my mom, and people know my mom on here, she was an evangelist. My mom
Mm-hmm.
had she had the gift of healing hands. And
Wow.
she was like, Jearlean, no matter what they took out, you're still whole.
Mm. Come on.
Listen, my mother's name is Nellie. Everybody called her Mama Nell.
Come on.
Like your grandmother, my mom, she
Yes.
spoke some things and she said, Geraldine, you may not have this or you may not have that,
Yes.
but you're still whole.
Come on. Come
Right. And
on.
I'm like, oh, I didn't get it until
You
I
didn't
got
get it.
old. I didn't get it then. But just
Mhm.
to hear this story, I'm like, oh my gosh, it's just so and it brings me
Similar.
back to like he's a miracle worker.
Yes, he is.
He makes all things possible.
All things. And
Did
he
you
makes
did
all
you
things new.
did you think there was going to be a second child, or you was trying for a second child, or
It was like I was optimistic. We both were, and I think our families were, but we also were like, but we're grateful for this.
okay?
Because we know like it could have been us on the other end, on the other
Mm-hmm.
side, because we know
Mm-hmm.
what it's like to long for a baby
Yeah.
and not be able to have a
Yeah.
baby. Or there's some people that have miscarriages, or some people that
Mm-hmm.
it's so I know that other side. So it was like we were grateful. We were just embracing her, kissing her, and loving on her, just
Yeah.
just enjoying every
Yeah.
moment. And then we're like, well, okay, year has passed.
Uh-huh.
Okay, 2 years have passed. All right, 4 years have passed. 5 years have passed. 6 years have passed. So it's like we were grateful. We were just embracing her,
Oops.
loving on her, kissing her, enjoying every moment.
Not sure what happened to La-Anna. Let me check here. We always say that this, y'all, the devil is a liar, because this story is so amazing. Um, we're gonna hope that she logs back in. La-Anna, you went out, or maybe her charger went out. Oh,
Hello?
hi. Oops, wait a minute. There we go.
Hello?
I say, the devil is a
Oh
liar.
no.
Come on back.
Okay.
You, you back, huh? Let me see. Yeah, it's just probably some technical issues. That's okay, but guess what? Mm-mm. She'll log back in, y'all, but you hear her amazing story, and a lot of this I'm like, I'm so amazed, but at the same time I'm learning. It's like, oh, so I'm learning, and it may sound strange what my body could have been. Here she is, y'all. What my body could have been. Hey, sis.
Sorry, sister. I don't know what happened.
That's okay. I said the devil is a liar because
I know.
ain't going. It's not gonna happen.
It's like, what
It ain't
happened?
going. It ain't going to happen. Thank you, putting the devil is a liar. Nope.
That's right. Satan, the Lord rebuke you in the name of Jesus. I was like, what happened?
Listen, so the
But
last time
yes,
you talk about, like, years have passed,
years have
and then
passed.
your second miracle.
Yeah, so Olivia, my oldest, started to ask, now she's getting older and noticing her friends having siblings, her cousins
Mhm.
having siblings. She was like, Mommy and Daddy, when are you going to have a baby? I want a little brother. When I have a little brother, they're going to sit right here next to me. When I have a little sister, they're going to ride in the car with me. So she was saying these things, and I'm like, I don't know, Olivia. Mommy and Daddy went through a lot to have you. Maybe it's
Mhm.
just going to be you. It's okay.
Mhm.
So about a year or two later, she said, like straight out, Mommy
Uh-huh.
and Daddy, are you going to have another baby? We were like, I just cried. I'm gonna be honest. I cried and I
Yeah.
said, Olivia, I don't think mommy's gonna have another baby.
Oh,
Because it's been years now. I don't think it's
yeah.
gonna happen for us.
Yeah.
And I remember during the pandemic, I was having pains on my left side.
Mm.
Horrible pains. I'm like, I never have problems on my left side. It's always my right side because of all the
Mhm.
stuff that happened in the past. I'm like, well, now I'm older. I'm 39 at the time. And I
Uh-huh.
said, you know what? I'm going to make my primary care appointment. Like now
Yeah.
I have courage. I'm like,
Right.
you're not going to tell me nothing. I'm not going to believe you saying that it's not this or not that. We're going to an
Yes.
appointment. So I went to my primary care appointment and she was like, are you sure? And I said, I'm telling you, something's not right.
Right.
She pushed on my left side and I jumped. She's like, oh, you know your body. I said, yes, I do.
Yes.
So she sent me for ultrasound. Soon I went to this a double balloon procedure where they inject balloons into your uterus. For me, it'll be
Mhm.
two uteruses, and they
Mhm.
check to see what's going on. So I had a whole lot of polyps and things like
Okay.
that. And they said, hey, do you remember you have fibroids? I was like, I honestly forgot.
Um.
And put it after all that I've been through. I was like, I put that in the back of my mind. She was like, well, your
Right.
fibroids have grown.
Ah.
That's what's causing your pain. I'm like, I have fibroids. And they said they're sitting right between your two uteruses. I'm like, wow. So she soon sent me to a doctor, this black female doctor. This is the first time I had a black woman. Nothing
Mhm.
against other doctors, but it was just
Right.
nice. And she was like, well, I have options. You can do a robotic laparoscopic myomectomy. We could do a total myomectomy. That's when they do
Mm.
a C-section scar around your
Okay.
belly,
Yeah.
on the bottom of
Mhm.
your belly. Or we can do a hysterectomy. And I was like, okay,
Mm.
I'm ready for hysterectomy. I'm,
Right.
I've been going through this for 30 years.
Yeah. Yeah.
Horrible periods, 2 periods every month, da 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 da, fibroids,
Um.
endometriosis, everything. And then I was also diagnosed with PCOS, which is polycystic ovarian syndrome.
Mhm.
I was like, yeah, take everything out.
Mhm.
She was like, are you sure? I was like, yes, I'm done. She said, what I want you to do is go home and talk to your husband about it,
Yeah.
give them the options, and then
Mhm.
come back. And I'm just like, okay, I'm ready to be done. Honestly, I was being real stubborn, to be honest. I go home and I remember talking to my husband. I'm like, babe, I really want to do a hysterectomy. I
Mm.
don't want to. I've already had multiple surgeries. I've been through so much.
Mhm. Yeah.
I'm
Yeah.
tired.
Yeah.
And his face, the facial expression, he looked at me and he said, babe, I really want you to do the robotic laparoscopic myomectomy.
Mhm.
I just try one more time because I think we're going to have a baby. And that face, I was like, I gotta be cut again. Because the thing is, if I did get pregnant,
Yeah.
I would have to have a
The
C-section.
C-section. Mhm.
Because
Mhm.
now I've been so many surgeries,
Yeah.
so much I've been
Yeah.
through. So I'm like, oh Lord. So we do the robotic laparoscopic myomectomy, and she was like, you're gonna get pregnant. And I'm like, you know, in the back of my mind, I'm like, okay, but I believe God. But I was like, okay.
Yes.
And I tell you, I had the robotic laparoscopic myomectomy February 2021.
Yeah.
I turned 40 in August.
Yes.
September 19th, I was pregnant.
Pregnant.
I mean, my body said, okay, we're ready.
Oh my
I
gosh.
was like, what?
The
At
second miracle.
40, second miracle at 40, after
Yes.
another 8 years of infertility.
Wow.
8 years the first time, 8 years the second time.
Yes. Wow.
8 means new beginnings.
Yeah. Mm-hmm. Mm-hmm.
What?
Mm-hmm.
What?
Oh
I was
wow.
like, what? Now she's 3 years old. Her name is Anaya Grace.
Oh my
And I
God.
mean, it's God's grace. Like,
Yeah.
it's
Yes.
that,
Yes. Yes.
it's no
Oh.
words. No
Mm,
words.
mm.
So had that C-section, but I remember during the C-section having her, the two doctors said, we see a lot of scar tissue. Look at all these scar tissue.
Ah.
I didn't understand. See, again, didn't when they're saying this, I hear them and I can feel
Yeah.
them pulling and
Yeah.
tugging.
Yes.
They said there's so much scar tissue. Oh my
Oh
gosh, we're gonna have to
wow.
cut higher. We're gonna have to do this, do that. I remember that, not knowing what scar tissue meant.
Yeah.
Didn't understand.
Mm-hmm. Mm-hmm.
So that was like that was 2022 when I had her.
Mm-hmm.
Years going by.
Mm-hmm.
Scar tissue, scar
That's scar
tissue.
tissue.
That
Mm-hmm.
scar tissue. Still not understanding. I'm living my life, raising two
Yes.
babies, loving on my husband, telling my testimony as a women's
Mm-hmm.
advocate,
Yes.
speaking. I even shared my story while I was pregnant with Anaya with the FDA and the White Dress Project. As
Wow.
there's my stories on the FDA, my stories on Apple News, my
Yes.
stories in the UK. So I've been sharing my story and helping Nigerian women
Yes.
and just, being a women's advocate,
Yes.
speaking at
Yes.
conferences. But scar tissue,
Mm.
we don't talk about scar tissue.
Mm-hmm.
That's like when you have a cut, that scab.
Mm-hmm.
Okay, that scab is healed, but what's underneath?
Ah. Uh-huh.
The scar tissue. So we don't talk about that.
Mm-hmm.
My husband and I, we've been planning this trip since the pandemic to go take, because for Olivia's birthday, we bought her some Disney tickets. But the pandemic happened, so we had to cancel the trip.
Yeah.
Then we get pregnant, and so timing again is always perfect.
Yeah.
So now Naya's old enough. Let's go to this trip. All right, let's
Yes.
go. June of last year, we head down to Florida. We said we're going to drive down there. We head down to Florida. And I'm like, I'm driving. Something's wrong. I'm in so much
Mm-hmm.
pain. I'm
Mm-hmm.
burping. I can't stand up. Something's wrong with me. So my husband goes and gets me some Pepto Bismol and all these things,
Mm-hmm.
ginger ale. I'm still in so much pain. Fast forward, we drive. My husband drives 17 to 18 hours straight to Florida. I'm in so much pain.
Wow.
My legs are in the dashboard. My arms are over my head. I don't understand what's going on. He's exhausted, but he was like, I got to get you to Florida.
Yeah.
I
Yeah.
said, don't stop. Keep going.
Mm-hmm.
We get to Florida. I get out the car. I'm leaning over. I can't even walk. It's so hot. He walks me.
Mm-hmm.
He holds my hand, walks me into the hotel. His mom is already there. And she says, La-Anna, come here. I look at her and I just collapse in the hotel lobby. What's going on? The doctors, the ambulance, the fire trucks, all those people come. The firemen come and they lift me up. They try to put the patches on me and put an IV in me. Everything's falling off. I'm sweating profusely. I'm throwing up. I don't
Mm-hmm.
understand what's going on. Fast forward, I get to the emergency room.
Yeah.
They start doing all these procedures and tests. I'm still in so much pain. I can't stretch my legs out. I'm in so much pain. I wanted to just cramp up. So they put this tube down my nose, start pumping my stomach. 700 milliliters of fluid comes out of my
Oh my
stomach.
gosh.
So this doctor comes in, this little lady, general surgeon comes in. She says,
Uh-huh.
hi, your vitals look good. But my eyeball test looking at you, you don't look good.
Uh-huh.
She's like, you don't look good.
Mm-hmm.
She comes and presses on my belly. I scream. She says, I was supposed to do a surgery on a patient. I'm moving that patient and you will be in the
Mm-hmm.
OR in 45 minutes.
What? You just got there
Just got there.
and you're about to have surgery?
And I'm about to have surgery in the state I've never been in, hospital I never got care at. She's never seen my anatomy. I'm telling her all my history real quick. While this tube is down my nose, I'm telling her I had 2 uteruses, 2 cervixes, 1 kidney. I've had prior
Uh-huh.
4 surgeries. I've had 2 babies. I've had
Uh-huh.
C-section. I'm like explaining everything to her. And she was like, "You're going to the OR." I get to the OR. My husband, that's when he comes in because he is exhausted. Just
Mm-hmm.
drove, got our kids settled in the room with his parents, and he's looking at me crying like I might not see my wife again. I'm looking at
Oh
him. I'm
my
like, this may be the
gosh.
end. We don't know what she doesn't know what's going on.
Mm-hmm.
She literally cut me from under my chest all the way down to
Yes.
my crotch area. And she opened me up and I had a complete bowel obstruction
Wow.
because of prior scar tissue.
From scar tissue.
From scar tissue endometriosis, my bowel slipped under like a rubber band, and my uteruses and my bowel literally flipped the
Like
opposite
was
way.
twist where they like, oh my
All
gosh. Ooh, I'm getting chills.
I could if
Yeah.
I believe if I was in Baltimore, nothing against
Yes.
Baltimore, but I feel
Right.
like my pain would have been minimized and they would have sent me
Mm-hmm.
home.
Mm-hmm.
I really
Mm-hmm.
believe if I was somewhere else, I
Mm-hmm.
would have been sent home. God had me go to Florida, not during the pandemic,
Right.
at June 2025 to see this particular
Wow.
doctor because she said during that week she had already performed that type of surgery 11 times
Yes.
on somebody else,
Wow.
on other people.
Did did
It
did
was
did, did they not think you were gonna make it? Wow.
literally, there's a story in North Carolina the same week that I had this bowel obstruction. A
Yeah.
black female preacher was at a hospital. She was complaining about pain, but she
Yeah.
had previously had a gastric bypass surgery. The
Mm-hmm.
doctor said, "I have never performed surgeries on gastric bypass patients. I will not open you up." She
Mm.
sat in the OR in the ER for
Mm.
16 hours.
Mm-hmm.
Finally, her friend shows up. She's crying. She's like, "I'm in so much pain."
Mm-hmm.
The friend demanded the doctor, excuse me, to be have her flown out somewhere else. They finally fly her out somewhere else. When they
Yeah.
cut her open, she passed
You
away.
passed away. Wow.
The same week I it happened to me. So
Yeah.
that if
Yeah.
that doctor sent me home and said, "Your vitals
Yeah.
are fine, go home,"
Mm-hmm.
I
Mm-hmm.
would not be here today.
Oh my gosh. Wow.
Complete bowel obstruction, and I had a hernia. And we're
And
supposed to be on we're supposed to be on vacation. But God said, "Oh no, I'm sending you for a reason to
mm-hmm.
Florida." I told
Yes.
my husband when my mom flew in, she was there with me, his parents were there.
Mm-hmm.
Take our
Mm-hmm.
babies, have a good time. I
And
know I'm all right. I'm okay.
yeah.
So he took them after I had my surgery and I got out, came out on the other side.
Yeah.
And the doctor
Yeah.
said what was going on. He took them, had a great time. But I bless the Lord that I'm still here.
Oh my
Another testimony.
gosh. Another testimony.
That was just
Another.
last year,
Oh my gosh. Just last year.
June of last year. And
And
look,
I want
I mean,
Jesus.
I look pretty good for
Yeah, I
it.
know that's right. So listen, y'all. I know we running over a little bit, but I
Yeah,
don't
yeah.
care.
Sorry, 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 sorry.
No, 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 no. So last year, but it was also last year. La-Anna and I, we kind of
Hmm.
keep in touch with each other through social media.
Yes.
So I had not seen her in a while. Then I get a DM from her,
Yeah.
and she says, "Sis," she says, "Sis, I had an idea for a
Hmm.
photo shoot that I want us to do." And I was
Yes.
like, "Oh, hey, okay, and I'm kind of semi-retired, y'all. I haven't modeled in a while. Nothing wrong. It's just other things going on I want to
Uh
do."
huh. Uh
But
huh.
she reached out, sent me a DM. She said, "Hey, sis, I have an idea of a photo shoot that I want to do. Let me get some stuff together, talk to this photographer, get some dates out." I said, "Okay, well, send me the details."
Hmm.
So it could have been maybe a couple of weeks later or whatever. She reaches back out to me. And so she gives me idea, her vision, and what you said to me. This is the theme of the photo shoot, which is freedom over fear.
Here. Yep.
And I'm thinking, I was like, this is her vision. This my friend, it's my sis. And I'm like, I'm trusting her, right? I'm
Hmm.
trusting her because I knew a little bit about her story.
Hmm.
So I'm trusting and she's like, okay, you're available this day, you're available this day, you're available this day. And so we finally get together, we get a date, we get a studio location. We
Hmm.
have listen, we'll talk about them. These wonderful photographers that Anna has shot with before. I never shot with them before. And she said, I
Hmm.
want us to do this photo shoot, a mission. And I said, okay, all right, let's do it. And so the theme of it was freedom over fear. and I want to ask you what how did it come about? Why did it come about? And I'm even gonna ask you why me? You know what I mean? Because
Yeah.
you could have shot with anybody else. You know, I
Mhm.
believe that too. But when we were talking about it, and then we started talking about it more and more, and I'm thinking, okay, but what was the vision behind it? Why did the idea come about?
The idea came about because I saw it was a day that was real rough for me because
Okay.
I at the time, and it's still I have my days because I have this long scar, this keloid
Yeah.
that runs down my
Uh-huh.
my belly.
Yeah.
After all I've been through, I've had incisions and little
Mm-hmm.
scars on my belly that I call beauty marks. But this is like major for me, and it mentally it was hard for me.
Okay.
When
Okay.
you're clothed, you feel comfortable and
Yeah.
beautiful, and no one can see what's underneath. And
Yeah.
then when you take your clothes off and you see yourself, it's like, wow, this is
Uh,
the new me.
yeah.
But like my mother-in-law says, but it's your lifeline. But
Ah.
I'm coming to the grips of, you know, this long incision, this scar down my belly, but it's a reminder that I'm still
Okay.
here. So I
Yes.
saw one day I was having a hard, rough day, and
Mhm.
I opened up Instagram and there's this picture of you in all of your glory, just beautiful, strong, showing your ostomies, and just like I'm me. I'm
Yeah.
beautiful, like,
Yeah.
and take all of me, like, this is who I am. God made me
Yes.
fearfully and wonderfully made. No matter what my story
Yeah.
is, I
Yeah.
am enough.
Hmm.
And it was like, whoa, like it was a slap in my face, like, God, you had me open this for a reason to see her at this moment when I was feeling uneasy and not
Uh,
beautiful.
hmm.
At that
Hmm.
very moment, I was feeling uneasy,
Keep
and
talking. I'll be showing some pictures, but keep talking.
sure. And so I DM'd you and I said, hey, sis, I have this idea about a photo shoot. And you just, at first I asked you, how do you do it? I think I asked you, I said, how do you just show, like,
Yeah.
and not feel embarrassed or feel
Yeah.
like you want to hide yourself?
Yeah.
And you were like, I understand you didn't like shame me. You said, I understand. Like, I
Yeah.
totally understand what you're feeling, but
Yes.
sis, I got you. Of course, I would do a photo
Yes.
shoot with you. I'm honored. Like
Yes.
and I was like, thank you. And then I started feeling, even when you said yes, I started feeling, well, maybe I shouldn't do it. Maybe I shouldn't
Mm-hmm.
do it. Maybe I'm showing too
Mm-hmm.
much. I was still
Yeah, you
questioning
still
myself.
like, yeah, 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 yeah. Yes.
Yeah, and
Yes.
and the theme is freedom over fear, but I was feeling afraid. Like,
Ah, even during that time of even
even during that
asking.
time, I felt afraid to show and to do
Wow.
this. And then it's like, no. And when I mentioned it to Miss Cynthia, one of the
Yes.
photographers that I work with all the time, she's
Yes.
fantastic. Yes,
Yes.
Miss Cynthia, Miss Renee, but Miss
Yes.
Cynthia, um, she was like, of course, what? Oh, yes. And so it just came together so beautifully.
Yeah.
And
It was
I'm
so funny
grateful.
because we had our location of our shoot, and I got there first, start putting my clothes away and things like that. And then you came, and then as I opened the door, we're looking at each other. But then, and I was like, "Don't start," because
I
La-Anna
know.
was the tears was about to come, and
Yes.
I was like, "No, not yet." It was
Hold
so
it. Hold it.
told it. It was so funny, but but I think also hindsight. I think also at the time. Oh Jesus, I don't want to get emotional.
I
Mm.
know.
I think at the time too, when you asked, it was like I needed it too. Of course, I'm out here
Mm,
modeling. I'm doing this, doing that, and And when I did
mm,
photo shoots of showing my ostomy bags, it was not just to
mm.
show, right? It was to say, when I go back to what my mom said, like, Jearlean, you are whole, right?
Mm.
Doesn't matter if you have bags or you don't have bags. And God was like, you're fearfully and wonderfully made, like how you are. And so,
Yes.
sis, when I show this picture, and you guys can
Mm,
see like Anna's scar from almost
mhm.
at the top of her breast to all the way, and it goes all the way down. And if you look
Down.
at me, I have the same scar from the
Mm,
top to the bottom, but with me, you see like the ostomy bags. But this is one of my favorite pictures is because no matter the
Mm.
scars, like we still have joy.
Yes.
La-Anna and I, we did not go over, okay, we're gonna pose like this,
Mm-hmm.
we gonna do
Mm-hmm.
this, and we did it just came so naturally. And the
Mm.
two photographers, Cynthia and Renee, they was like, and they had like two, three, and cameras, and man, like, and like so we're so thankful for them as well.
We love them.
But I'm like, oh my gosh, like it was meant to
So good.
be. It was like it was meant to be. And this is the crazy part too. So this outfit is
Yeah.
actually the outfit I have on is Anna's outfit, and then I think a week before, like Anna called, she texted, she was like, sis, I'm about to go on vacation and I gotta get some braids. And I'm like,
Yep.
but at the same time, I was about to get braids as well. We never talked about, okay, the makeup. Can you do this? We both walked in there with natural
Same
makeup.
makeup.
And this is the trip part. We both walked in there. We had our lip color was natural. So it was like it was meant to
It
be.
was meant
And
to be.
so like this shot right here, our head, and we might
Yeah.
say, oh, flip it this way, whatever. So it just kind of it was meant to be. And so
Yeah.
when I look at this, it's like I mean I could just cry right now because
Aww.
um it was just, and I was telling her, I said it's probably one of the best photo shoots I've done. And both her
Aww.
and I have done so many.
Yeah.
But but when you
Aww.
look at these pictures like this,
Mhm.
it just it just gives
Yeah.
me a reflection of how far we have come,
Yes.
how
Yes.
far we have come.
Amen.
But it's like now, we're on a mission to let other people know that
Hmm.
your story matters, and again, like,
Yes.
you're fearfully and wonderfully made. And I
Hmm.
like that. I like this where it says freedom over fear, but sisterhood. Like,
Mm.
and then like Anna sends me another picture. She's like, Sisterhood of Survivors. I'm like, oh,
Yes.
wait a minute. What does that and the Lana comes up with all types of stuff, and I'm like, oh yeah, yeah, that's good. But when you said Sisterhood of Survivors, what is that? What does
To
that mean
me,
to you?
like the fibroid awareness advocates, the White Dress Project, I call them my sisterhood.
Okay.
Indo Black, I call them, for endometriosis, I call them my sisterhood. When
Ah,
I was diagnosed with all the things I went through, there was no support groups. I didn't see anyone else that I could look at and see a mirror image. I didn't see anyone else that was going through what I was going through. And then now I found these advocates that are standing side by side and supporting me and supporting each other. And
mm-hmm.
so I call them the sisterhood. And then for you, being, even though our stories are different, we are
Yes.
connected. I always feel like all of our stories are different. We are connected in some way or somehow because maybe we felt the same way, or maybe we have the same scar, or maybe
Yeah.
that hurt that we felt was the same, even though it was a different journey. So it's a sisterhood of survivors.
Yes. Yes.
We are in this together.
Mm-hmm.
For years, especially in my 20s and as a teenager, I thought I was by myself. I
Yeah,
was the
me too.
only one going
Yeah.
through this. I was the only
Yes.
one feeling this pain, only one that was sexually abused, the only one, the only
Mm-hmm.
one. Now, as a grown woman in my full self
Mm-hmm.
and confidence, even with my invisible scars and my visible scars that are now beauty marks, I'm
Yes.
not by myself.
Yeah.
So
Yeah.
we are sisterhood of survivors
Yeah.
who
Yeah.
are thriving,
Mm-hmm.
who
Mm-hmm.
are thriving. So
Yeah.
that's where that came. That is something that means that we are in this together, no matter what we are facing. No matter, we can call each other, we can message each other. It's still sisters now that message me and say, "Hey, girl, I'm going through it," and I
Yes.
and I can encourage her, and then I can do this. She can do the same for me. So we are a
Yeah.
sisterhood of survivors.
I mean, I know you talk about, like, for us, like, our story is our story. Nobody can tell it like we can. But you also talked about how our journey is not all about our surgeries, our diagnosis, or our
Mm-hmm.
setbacks, you know, because when
Mm-hmm.
you think about, oh, I went through this surgery, I had this many
Yeah.
surgeries, but let me ask, what is it on the other side of all of that? What's on the other side? Because we get stuck
Mhm.
in, oh my gosh, another surgery. And I know I did when I was younger,
Mhm.
oh, hospital bag, da, 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 da.
Yeah.
But there's something on the other side of
It
that.
is.
What is on the other side of your something?
It's life.
Yeah,
I still have life to live.
yeah,
I'm still capable and able to put my hands to the plow. There's still so much in store for me to do. There is
yeah,
still purpose in me.
yeah.
Fibroids, endometriosis,
Mhm.
PCOS, the diadelphys uterus may have been a cause of my pain, but it will not control my purpose.
Mm.
So no matter sexual abuse, okay, those abusers, they don't validate me. Those abusers don't, take
Yeah,
charge of my life.
yeah,
So I
yeah.
had to learn to heal from that. I forgave them,
Mm-hmm.
but I'm not living in the past.
Okay,
So
okay.
okay, what am I doing now? Okay, I need to reach forward. For
Yeah,
that little girl, for that 5-year old that was abused, okay, I
yes.
need to speak up for her.
Okay.
For the little girls that are coming behind me, I have to speak up for her so I still have more life to live. What am I
Yeah.
going to do with this platform?
Yes,
With this
absolutely.
with this testimonies, what am I going to do
Yes.
with it? Am I just going to keep it to myself?
Mm-hmm.
Well, that's a disservice to the Lord and disservice to me.
Yeah,
That's a
yeah.
disservice to my grandmother and all those
Mhm.
that pray for me, to my husband. So I
Mhm.
have to share that testimony, no matter if it may be hard. Some people don't want to hear it. Okay, then it may
Mhm.
not be for you. So I shake the
Mhm.
dust off my feet and I
Mhm.
move on to the next house, the
Mhm.
next platform, the next
Mhm.
business, the
Mhm.
next conference, those that
Mhm.
will receive it. Because there's
Yeah.
so many girls, so many women, and we can't leave out the men and the young boys that are
Yeah.
suffering in silence.
Yes.
There are
Yes.
so
Yes.
many, because I suffered in
Because you
silence.
did.
There's so
Because you
many.
were there at one point.
I was
Mhm.
there. So I have to keep talking about it. I have to
Mhm.
keep moving forward because I'm still here for a reason.
And this is something I kind of not say discovered, but we've been used and abused in our life in many, many different ways, right?
Yep. Mm-hmm.
And I was like, I was just talking because I talked to God like that, and I was like, God, you are a user. And I'm like, Jearlean, watch what you say now. But I'm saying, God, you are a user. Like he has to use somebody. He needs
Mm-hmm.
a vessel.
Mm-hmm.
He needs a vessel, right?
Yeah.
This testimony, this story that he's given us, he's given to us for a reason.
Mm-hmm.
And for a long time, and you kept it to yourself.
Yep.
Nobody can tell our story like we can, but our
Mm-hmm.
story belongs to somebody else.
Mm-hmm.
It belongs to somebody else.
Mm-hmm.
And I've said this before, and I was like, and another reason why I would say I came out and started talking about my testimony is the devil can't use it against me anymore.
Come on.
Because again, get in our mind, you're not
Mm-hmm.
this, you're not worthy enough. I always said, Jearlean, you're not going to get married, you're not going to do this, and you're not going to do that. Like that mind game, oh my gosh, it is
Mm-hmm.
that's a trip within itself. But when you start speaking and when you start first, you got to give glory to him, because if it was not for him, you would not have this story, right?
Oh.
And it's like I got to start talking about it. And I think we both too, we can't be ashamed of it. There's
Mm-hmm.
nobody's fault that I've developed cancer.
That's
It's
right.
not. It's not anybody's fault. You could say it's hereditary, maybe, yeah, but it's nobody's fault. And so it's like, Geraldine, you gotta, and you too, like, we gotta speak to the voiceless. A
Yes.
lot of people not talking about it, and like I'm like tonight, I'm like, oh my gosh, what you what you know what I mean?
Yeah.
And maybe people may not understand it, but at the same time, somebody needs to hear it. So I say to you, your story it's something. You know what I mean?
Mhm.
It's like, girl, you done been.
I
And I
know.
know
I know.
our viewers can say the same thing. Oh my gosh, I can't believe when you said two universe and two stars. I said, what?
I
I didn't
know.
know. And
Yeah.
also we have to tell it because people they assume, but it's just kind of lack of knowledge, and so we have to teach them. You know,
That's
people
right.
like, what's the ostomy? Why you wear a bag? You
Right,
know,
right, 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 right.
they're not
Mhm.
being ignorant. They just don't
They
know.
just don't know.
And so, I'm grateful and thankful that God put us in our path together.
Yes.
And it's been an amazing, I would say, couple of months because people are so amazed. Like, oh my gosh, these pictures. And I'm listen, the pictures are amazing. I'm so
I know, right?
but I do want to say to you, I do thank you for sending me that DM and asking me to be a part of that special photo shoot. And we're gonna have another one, y'all.
Yes, we are. Yes, I believe it. Even
Yeah,
more glamorous. Yes.
yeah, we're gonna, and I thank God for the vision you had for this photo shoot. I thank the
Mm.
photographers Cynthia and Renee, and we do want to shout out the Lab Baltimore, who
Yeah.
who blessed us with the location for the photo
Mm.
shoot. But I want you. We're gonna end tonight. It's been wonderful. It's been wonderful, wonderful,
Oh,
and very
thank you.
informational. I'm so proud of your testimony. I'm so proud
Thank
that you're
you.
talking about it. Leave something with our viewers tonight.
Just know that you are enough. No
Mm-hmm.
matter what you face, no matter what you're going through, you are enough. You are loved. You are worthy
Yeah,
of love.
yeah.
You have the right to speak up for yourself, to advocate for yourself, no matter
Yeah.
what it is. If
Mm-hmm.
the doctor is not listening to you or minimizing your pain, please research and go for another doctor.
Okay.
Speak up for yourself and allow others to love on you as you love on yourself. Take time for
Uh,
self care. Self care is very important, but also allow family to love on you. Don't
okay.
let anyone tell you that you cannot have a child, you cannot
Mm.
have your business, you cannot have this
Mhm.
blessing, or you can't get that loan in the bank, or you cannot do anything you want to.
Yeah,
Don't let
yeah.
nobody limit you because
Mm-hmm.
God is
Hmm.
limitless. God can do
Yes.
anything He
And
wants to.
yes, yes,
I'm
yes,
a
yes.
living witness of that. Over and
Mhm.
time and time and time again, He
Yes.
worked a miracle through me. And if He did it for me, He could do it for
Go
you.
for you. Yes,
So
absolutely.
don't give up on yourself. Love on yourself and know that
Yeah,
you are enough. Hope
yeah,
still
yeah.
stands.
Hope still stands. Yes, let's get. I want to do show. I got something going on with my screen, y'all, but I want to actually show you this tonight, right quick. And this is another thing. Oh, wait a minute, messing up here. Let's see, right here. Oh, right here. I think you can see La-Anna's
Oh,
Instagram.
yes.
So, and listen, y'all, every day or every morning, whenever I can go on to her either her Instagram or her Facebook, and she's going to have something inspirational on there. She's
Oh,
going to. So, go on her Instagram or her Facebook. Hope Still Stands. Go on there, take a look. If you need some motivation or some inspiration, I know I go on there every day. I don't
aw.
stalk her, but I need some motivation too. So go on there and yeah, just see what she always has something positive to say. And we need that in these times and days.
Hmm.
So I thank you so much. Thank you for joining us. I'm gonna put you behind stage
Sure.
and
God bless you.
thank you so much again. I'll be right back.
Okay.
Um, all right, let's go here. Who is this one? Okay, wait a minute. Okay, there we go. I don't know what happened to my screen, y'all, but but I want to thank you all for coming on tonight. Let me see. There we go. Thank you all for coming on tonight. We're coming back. This is our first time back for the new year 2026. And so we definitely have more guests. And we got new viewers as well. Thank you all so much. Again, I thank God for giving me the vision of Talk Tuesday and to bring people on like La-Anna and to share her story and her testimony. So thank you so much. You'll see a flyer for our next guest. It will be next month sometime, so you'll see an announcement for that. I'm going to do a recap as I always do. I'll put La-Anna's social media on there. Please reach out. Just send her a DM. Let her know how much you enjoyed her story and her testimony tonight. And so, all right, guys, I'll see you on next month. Then I got to get out of it. There you go, screen. Oh, there we go.